Hi, tongue tie means there's a band of tissue which connects the undersurface of the tongue to the floor of the mouth. The band of tissue sometimes it starts from the tip of the tongue or maybe just behind that. So, depending on the severity, it can be classified as from mild to complete. So, grade 1 to grade 5, and I have given the measurements too. The mild cases, it goes unnoticed. In this video, I'll tell you mainly about the moderate, severe and the complete type. So when a child, the newborn, has got tongue tie, they have problems with feeding. So whenever the child is breastfed, the child keeps on moving, the infant keeps on moving, and the child will not have a normal sleep also because he is not able to take the feed normal completely. And due course, they may lose weight too. Suppose at this particular age, like say infancy is managed well, and they didn't have much a problem with feeding, and when they start talking, like starting with few words, certain words they will not be able to pronounce normally. Like the words are T, D, N, S, R, Z. Because to pronounce these words, you need the normal movement of the tongue, especially the tip of the tongue should be able to touch the floor, the palate normally. You try these words, T, D, the tip of the tongue has to touch on the roof. So since the child has got severe or the complete type and he is not able to touch the roof, he will not be able to pronounce properly. Not only that, if at this particular stage it is neglected and the movement of the tongue is not normal, they may have tooth decay or sometimes even difficulty in swallowing also. Now coming to the examination part. So when I ask the child to open the mouth and protrude the tongue out completely like this, the child will not be able to do that. Means that normally the tongue should be able to be protruded lower than the level of the lower lip, and the tip has to be rounded. But in a case of tongue tie, which is grade 3 and grade 4, that is severe or complete type, they will not be able to protrude completely. Not only that, the tip will be heart-shaped, like how you see in this picture. When I ask a child to lift up the tongue so that I can have a look at the floor of the mouth, the band is seen clearly. So these patients, these children, they need treatment. Now, surgery is the answer for this. So if at all investigation is needed, what I need is basic coagulation profile will be more than enough. Coming to the treatment part. If it is infant, say less than 1 year old, the procedure can be easily performed in the ENT OPD itself. It hardly takes 5 minutes and the child can be discharged within half an hour to 1 hour. Suppose the age is more than 1 year and child is very cooperative, even then the procedure can be done in the OPD and they will be let go within half an hour to 1 hour. But there are certain children, they refuse to even come inside the consultation room and they are not at all cooperative. In these conditions, they have to be taken to the operation theatre. Under mild sedation, the procedure will be completed and they can be discharged within 1 hour. So, what are the post-operative advice? That particular day, we'll ask them to take cold water and ice cream. And bleeding is minimal. That's all. Avoid spicy food, hard foods, and hot liquid. cold will be better for that particular day. That's all. And exercise to be done for 4 to 5 days, which I'll tell you. And the 5th day onwards, they can go for speech therapy, which usually 5 sessions will be more than enough. The reason being, all these years, suppose they come late, all these years, they have not been pronouncing the words properly. So we have to train them to use those particular words mainly. Now, I'll show you some video of the procedure. See, the bleeding is minimum and stay to the midline. It is done as a OPD procedure. That's it. This is a pre-operative picture. This is a post-operative one. So pre-operative picture, when I ask the patient to open the mouth and protrude the tongue, see what happens. She is not able to do it completely, and the tip is not round. You can see the notch there. It's heart-shaped. Then when I ask the child to lift the tongue up, you can see that. Just wait. It will become more clear now. See this band? See this band? Now, this is post-operative one. The tip is round and the notch is gone and the frenulum or the tie is completely gone. Coming to the exercise. So, I have told you before that for next 4 days, we need mild exercise for those children above the age of 1. It's very simple. Ask the child to protrude the tongue completely, repeatedly. 1, 2, 3, like that 10 times. Likewise, the first one was below, next one should be above. Open the mouth, tongue upward. 10 times. Simple. So this will be done 10 times each for 4 days to 5 days. And from 5th day onwards, they can go for speech therapy, and that will be totally of 5 sessions. So that's how we manage tongue tie. Thank you.